Good morning, everybody. Well, it's morning here. Welcome back to the Medic on the Move YouTube channel. Craig here, back with you. And I say morning because it is 5:43 in the morning. And why am I talking to you at this hour of the day? Well, because shortly I'm heading off to work because I'm on day shift. And so I got up at 4:30, shower, dress, breakfast, and here I am. If this is the first time to the channel, please like and subscribe and share if you would be willing to do that. And hit the little bell. I think the bell is activated, so that lets you know each time we do a video. Thought I would just quickly catch up with you before I head off to work with just some little tips for those of you who are student paramedics, or you have just hit the road, or you're in your first period of time where you are out on the road. This is week 6 for me on the road as a cleared paramedic. And obviously it's still early. And I thought it would give you some tips about what I am doing for, what would I call it? Evolution, progress, and continually trying to improve and sharpen. Now, the reason I'm speaking a little bit more quietly than normal is because of the time of day, and I live in an apartment block and there's people there and people there, so I don't want to wake them up. Here's what I do. Go to work, do a 12-hour shift, and they're always busy here, the shifts. I keep a note of all of the patients that I have for the day, and just briefly, what the call was, what their condition was, what I did for them, and then what the feedback is from the nurses or the physicians at the ED in terms of when they do their assessment, what angles they pursue in assessing the patient, and what findings they have initially. Now, obviously, we're not at the hospital that long for me to be able to be there and, excuse me with my throat, to be there and find out what they ultimately assess. But that's the window that I have, and so I try to use it as best I can. Then what I do is come home after the shift, have a shower, and have some dinner. Loving being in my new apartment and the fact that I've got a kitchen that I can cook. And for those of you who know me, will know that pasta is the big thing. Anyway, I'm getting distracted. So first thing I do is come home, shower, dinner. Then what I will do is I've got 3 reference sources that I go to. The first one is the Acadian Ambulance Green Book for Louisiana. This has got all of our clinical protocols in them that we work by. And this is my little book that I, printed out, or the wonderful Christine, my teacher back in Lafayette, printed it out for me. And I'm old-fashioned, so highlight everything and write all over it. Probably wouldn't make sense to many other people, but it makes sense to me. So first thing is I come back to the protocol and I follow the protocol, and I really like the way Acadian set everything out, whereby this is the asthma one, and I hope you can see it okay. So it's got presenting signs and symptoms, what the differentials are, what else could it be, or what else could be involved, the history of the disease, and then it leads you through the steps and the medications and the things, interventions that you would need to do. And down the bottom, they've got these pearls, which are really useful, sort of little prompts and important things for you to think about. Now, when we get dispatched to a job in the ambulance, as soon as I read the data terminal and see what it is, I get out my white book, even though it's green, but I get out the white book and I will have a look. And if, let's say we're going to, 30-year-old female having an asthma attack. So I get this out and I just refresh. We also have an app on our phone that we can look at. So just refresh. Important not to get locked into anything, because you get responded to somebody that's got asthma and you get there and they've got, COPD, or they've got congestive heart failure, and it's not quite what you thought you were going to, anxiety attack, panic attack, whatever it might happen to be. So I will also have a good look at the asthma one, and then I will also flick over to, all right, what else could this be? So I might go to COPD, I might go to, allergic reaction, congestive heart failure, whatever it might happen to be. And I'll just brush up on that. And then go to the job, do what I have to do. If I need to reference the app while I'm with the patient, treating the patient, I'll do that at the right time. And I can't encourage that more strongly. Whether you're a 30-year veteran or new, there is nothing wrong. It is good practice to refer to the manual or to the app if your service has an app. Because if it's going to avoid errors, then that's in the best interests of the patient. And at the end of the day, that's what we're here for. So that's at work, okay? Then back to when I come home, jumping all over the place. 10 to 6. So I'm home. So then I review the job and I look at the green book and what it says. And I have my little notepad that I take notes on. I wish I was this studious when I went to school. Won't go into that. Then I have another book, and I also have this in the ambulance with me as well. And these are all of the medications that we carry with us. So it's got the name, this is adenosine, it's got the classification, it's got the physiologic effect that this drug is used for, indications, contraindications, side effect, additional information. And again, I have color-coded it, and then I have little notes in here for me as well. And the other thing that I've got in here, but it's also in the Acadian, let me show you, and I just hope that you can see it well enough. Let me take this out. Now, I don't know if you can see this well enough, but right here, diltiazem, which is a calcium channel blocker. The good thing about the Acadian app and the notes is that if you have to draw up medications and dilute them or get them to a dilution and a presentation to administer them, it tells you what the preparation is. So it's inject 10 ml of normal saline into 100 milligram, the 100 milligram vial, which then gives you a 10 milligram per mil concentration, and then you dissolve it and then you draw up the required medication, which in this case is 10 milligrams intravenous or intraosseous slowly over 2 minutes. And so if it's 10 milligrams per mil, once you've diluted and you're giving 10 milligrams, then you know you've got to draw up only 1 mil to give this patient. So that is very helpful. Back in the day, when I was in ambulance, the first time we didn't have apps, and we didn't have, like, did we have? No, we didn't have books. So we were expected to have all of this committed to memory, and you got tested on, when you were setting your panels and your assessments, you got tested on how good your memory was. And that's fine if you've got a great memory, which I don't. The problem I have with that is some of the or a lot of the situations that we work in are high pressure, high stress, noisy, lots of distractions, lots going on. And if you're relying on your memory to recall drug dosages and what to give and when to give it and how frequently to give it, we're only human, and there is a risk that you could remember the wrong dose for the wrong drug. The wrong dose? You know what I mean? So that's dangerous. So I would go as far as to say, basically, globally these days, there is almost the expectation that you check before you give it, particularly for those drugs and those sorts of conditions that we don't get frequently. And again, I will check that on the way to the call as well. And it doesn't take long. Even if you've got a very short response time of 4 to 5 minutes from the job, as soon as I see what the call is, boom, I pull them out of my bag, and literally still within that 4 minutes, I'll have had a good look and refreshed, and I've got the app if I need it, and I use it. And also, you will notice too, for you paramedics, that when you go to the hospital, frequently you will see doctors and nurses will go to check on things before they administer as well. And that's just good practice, in my opinion. So make sure you do that. And then the other thing is, once I've checked the protocol, once I've looked at the drugs and compared that to what I did and just make sure that I was on the right page and that I didn't miss anything, then this is Nancy Caroline was basically one of the gurus of pre-hospital emergency medicine, and wrote one of the first ever paramedic textbooks here in the US, and this has been updated, over the years. It started as one volume, back in the 70s, and there's been numerous revisions. This is edition number 8th edition, but I think the 9th one is already out. But there's volume 1 and volume 2 is over there. I will then come back and let's stick with asthma like we were before. Then I will go to the guru, Nancy Caroline, or Brian Bledsoe's book as well is fantastic, and there are others. And then I will do a review on what the academic teaching side is for asthma. And I'll look at the pathophysiology, presentations, progression of the disease, signs and symptoms, what it says about best practice, best treatment. And so between these three things, I then formulate all of that on my little notebook and go, okay, all right, well, we hit this, we hit that. And next time I just need to make sure that, I have a look at that. So it's not about mistakes, because I always check before I do anything. The higher risk activity or medication, the more you need to be prudent about checking what you're going to do. So that's how I review those things. And then I keep all of the bits of paper and use that as like an ongoing process for development. And I think it's really very important that we do that. It is nerve-wracking in the shortly after you get cleared, because you've had all of that time where you've been working with a senior paramedic, and even though they've had you treating the patient, but you're there, you're doing your thing, but you know that if you've got a question, there's somebody right over your shoulder. But as soon as you get cleared and that little guardian angel is not on your shoulder any longer, then the pressure is greater. And I feel that, absolutely, and that'll take time to settle. And so when you haven't got the guardian angel there with you, what is the next best thing you can do? Well, number one, preparation, which is doing this sort of work. And number two, get as much feedback. I will always ask the people I'm working with and the nurses, was that okay? Did I miss anything? Do you have any recommendations? Then I come home and I do a review to just consolidate and continue to learn. That's what I do. Hopefully it's helpful to you. If you've got some suggestions on the things that you do that you think would benefit everyone and myself, I would love you to drop a comment and let me know. So I better get moving. Time to go to work. Hope you're well. Hello to Melanie. You know who you are? Melanie is a new friend here in Louisiana, and she watches these YouTube channels, videos, and I said that I would say hello. So once again, like, subscribe, share and comment, and I look forward to seeing you very soon. So in the meantime, keep smiling, stay healthy, and bye for now.